A lot of men can develop low testosterone, and there's many different reasons why that occurs. In fact, there's ongoing debate on whether or not there's what has been affectionately coined the menopause, where the testosterone levels drop and people become symptomatic. Now, not everybody will develop low testosterone, and not everybody who has the symptoms of low testosterone necessarily has low testosterone. But we have found that in folks who experience symptoms such as decreased sexual drive, sexual interest, fatigue, generalized weakness, if we measure testosterone levels in those patients and they are below a certain absolute value, what we found is that if we replace that testosterone with an exogenous or an outside source, then we can relieve a lot of those symptoms. Literally, we check the testosterone level. We can actually see what those levels are, and if they're below a certain threshold, then we would recommend replacement. Now, we have to be careful on the testing because the testosterone levels do tend to fluctuate throughout the day, and we want to check it at a point where it's technically at its peak, because if it's at its peak and it's still low, then we know it's low throughout the entire 24-hour period. So we have different choices on the replacement of testosterone. The traditional method of doing so was done by injections, often depot injections that would last a couple of weeks. And the problem with that is there tend to be sort of highs and lows associated with it. You'd get an injection and feel great for a couple of days, and then as the medication wore off and you were getting nearer to another injection, some of your symptoms would come back. There are, I think, better ways of delivering it. There are transdermal applications. There are patches people can use which provide a sustained release. There are daily gels that people can use. And then there's also long-acting depot devices that can be implanted under the skin that elute this over a long period of time. So the people that are most affected by this tend to be in their late middle age. I tend to see most of these patients in their 50s to 60s, sometimes a little older and sometimes younger. I do see it in young men as well. And we have some other alternatives that we can sometimes pursue in young men where fertility may still be an issue for them. When we're treating this, we're trying to see patients with low T within the framework of our new men's health system. And that's going to be a joint venture between us and endocrinology. So most of the low T patients are actually going to see an endocrinologist more so than a urologist. But the point of us treating these patients is that we want to look at their overall health status. It's not a machine to just come in, get your testosterone replaced and go on your way. We're going to follow you. We're going to make sure you have the appropriate response. We're going to make sure that you don't have abnormal issues with reactions to the medication, and we're going to try to look at the big picture and see, is there some other reason why these things are occurring? One of the reasons for low testosterone, believe it or not, is a tumor in the pituitary gland, and not everybody's going to have that, but certain people are going to present certain ways, and we're going to be looking out for that sort of thing. We want to provide care to the whole man, not just his testosterone axis.